Good evening, friends. This is Colonel Pradeep Pendyala, Professor of Anaesthesiology, and today I am going to talk about why you should choose Anaesthesiology as your specialty subject. Today I am going to tell you why you should become an anesthesiologist, and this would be very interesting talk. Certainly, anesthesiology is an important field. It's a silent force behind the scene. I'm sure you would agree. And I must say it's an exhilarating field. I'll prove it beyond doubt why I have said it so. Now, when you do treat a variety of patients, unless you specialize in only one specific area, you are bound to expect to care a wide variety of patients, ages, and medical conditions in one day. Instant gratification is almost a guarantee. Controlling your patient's functions with medication is really a wonderful experience. The most commonly reasons I would love to say to become an anesthesiologist would be definitely if you love your physiology, pharmacology, and hands-on procedures, go for it. Go and become an anesthesiologist. There's a lot of happening in this specialty. There is also immediate gratification from your interventions. Not just, oh, BP is low, give some vasopressors. That's not the only thing you will be doing. You'll be treating variety of patients. Anesthesiologists may put people to sleep, but just putting somebody to snooze is not just the only job you'll be doing. The setting, although many people prefer to become ambulatory professionals like outpatient doctors setting. By the way, the work of anesthesiologists takes place in more acute situation. Anesthesia is such a wonderful specialty. You would agree some doctors do enjoy sitting in a clinic for 40 plus hours in a week, talking and listening to patients. Other doctors prefer acute care where more exciting things happen moment to moment, ordering diagnostic studies and prescribing a variety of pills that suits some of those MDs professionals. But if you are an anesthesiologist, you would be working in operating rooms and intensive care units. That would be really very stimulating and exciting and exhilarating. That's what I was telling. It's exciting controlling somebody's airway, breathing and circulation. It's really exciting having somebody's life in your hands if you are an anesthesiologist. You would really enjoy a lot of variety. Again, work of anesthesiologists may not be just limited on paper. It's extremely varied. Anesthesiologists do care for patients of all ages across a broad range of medical conditions, from heart, respiratory, brain, and gynecology, obstetrics, cesareans, trauma, name a field, anesthesiologists do, including pediatrics. They work. And they are so satisfying job experience they do have. Anesthesiologists work in many types of cases. Anesthesiologists are fortunate to have a satisfying career. I can assure you in academic medicine, every day would be different. I'm sure when you are an anesthesiologist, using latest medications and devices in the operation room will be very exciting. Each day you'll be doing some different procedure and working with some research work also automatically. And by the way, if you love technology, anesthesiologist is the choicest subject Anesthesiologists work with a lot of cool gadgets. Believe it. They do work with the latest gadgets. And the modern anesthesia workstation is full of computers and computerized devices. They use monitors on patients. The modern anesthesia workstation is almost like an aircraft cockpit. Work-life balance. That's amazingly good being an anesthesiologist. I again repeat, the work-life balance would be most satisfying when you are an anesthesiologist. Work of an anesthesiologist is demanding, I would agree, but inside a hospital. Outside the hospital, anesthesiologists have usually, they can easily walk away having a whopping 50% of the anesthesiologists would say that they do have a whopping 4 weeks of vacations annually. And this would definitely prove beyond the work-life experience and balance is nothing like being an anesthesiologist. They are almost characterized alongside dermatology and radiology as a lifestyle profession. This is not to say that the schedule of anesthesiologists isn't intense. By the way, they usually get up at 6 a.m. in the morning and their work starts by around 7:38 for sure. And they do work and finish most of their operation list by around 2 or 3 p.m. After that, usually they have lots of free time of their own. Occasionally I do agree, occasionally they keep working late in the night and they come home when their family is in bed. You would definitely enjoy being an anesthesiologist. Being in the hospital is definitely stressful and scary for many people. The scary experiences would be there. But anesthesiologists are uniquely positioned to bring comfort to patients and their families through pain relief. And that's an excellent, fulfilling experience. By the way, anesthesiologists do make a lot of money. While money should never be the primary reason to pursue a particular profession, but I must say it's a major selling point and anesthesiologists do make money. Thanks for patient listening, and this is Colonel Pradeep saying goodbye to you. Until next time, take care. Bye-bye.